I'm Dr. Helane Fronek, and it is a true pleasure to welcome Terri Morrison today. Terri is an extraordinary woman who is a phlebology nurse, which is very specialized. And Terri and I are kindred spirits. We both really fervently believe in compression. And Terri, I understand that congratulations are in order. You've just been elected the American College of Phlebology's representative to the international compression community.
Yes, I was totally delighted because I love compression stockings. I believe in them for our patients and all my friends. So it's a great honor.
Well, I think they definitely chose the right person. As we were just talking about, you and I are both wearing compression.
Yes.
Who do you think should be in compression stockings?
Well, I think everyone, particularly over the age of 15, should probably wear compression stockings. For many years, we just suggested that patients wear compression stockings after treatment. But as I learned more and more about compression, we gradually went to talk to other doctors, even that were not in phlebology, about having pregnant patients wear compression stockings, the elderly who certainly weren't able to have their veins treated right away, or in lieu of compressions, in lieu of vein treatment, we need to have compression stockings to help with venous disease.
Okay. So we can prescribe compression stockings for our patients who come in the office.
Yes.
But are there any other groups of patients who maybe don't come and see a phlebologist who you would recommend should wear compression stockings?
Yes, I think particularly what comes to mind first is pregnant patients. I for sure taught my own daughters, as well as all of our patients, to wear some type of a graduated compression stocking during their pregnancy. And sometimes that's hard, especially because we live in Arizona, for example. But even if my daughters were out and about, I said they have a knee-high, open-toe type of compression that they could wear to work, for example. And I just said, you don't have to wear them in the heat of the day, you know, if you're out doing errands. But for prolonged sitting and standing in the home or at work, I certainly would have done it.
What I tell my patients is you don't have to be a slave to your compression stockings, but make your compression stockings work for you. You mentioned when people are standing or sitting for long periods of time. So I would imagine, in addition to pregnant people, how about people who have standing occupations? Do you recommend that?
Yes, in fact, I was a nurse in the hospital for 20 years, and I've had friends that say, well, I quit working, you know, standing on my feet, so I took a desk job. And I said, you need compression stockings to sit at your desk. It's just as bad for your veins.
Right. Before I went to medical school, I was a waitress. And I remember coming back from my shift and my legs were just throbbing. I wish I had known about compression stockings then.
Yes, and my mother was a beautician. And she did actually wear support hose during the time that she was a beautician, but when she retired, then she thought she could give up her stockings, but then that wasn't good either.
Not a good idea. So we both think that everyone should wear compression stockings, especially pregnant people and people who have standing or sitting occupations.
Yes.
You mentioned knee highs and thigh highs. How does a person know what kind of stocking to wear?
Well, I think it would be good, first of all, probably to have go consult with a phlebologist or a doctor that's familiar with support hose at least, because I certainly wouldn't want knee-high socks on somebody with varicose veins around their knee area, so they would cut off their circulation and cause more problems. But there are so many varieties. In a lot of the drugstores, people can go in and get a lightweight compression that doesn't even need a prescription. And if they wore that in a thigh high or a pantyhose, as long as they don't have varicosities in that area and were properly fitted, then they could wear different varieties.
Okay, so people can come and see a phlebologist, a vein doctor, or you can go to a pharmacy, right? I often tell my patients that the one word they should look for on the package is the word graduated.
Yes, because there's a big misconception. Usually when I tell somebody to wear their compression stockings on a flight, for example, the first thing they said to me is, I think I have some of those TED hose from a surgery.
Right.
And that's my first thing I always say, TEDs are for bed.
TEDs are for bed. I like that. I'm going to try to remember that line. That's a good one.
So we try to get, now there's a new thing out that people can go to sports stores actually right now. It's relatively new, but many of the sports stores now are starting to carry graduated compression stockings for athletes.
Really? What do they do for athletes?
They help in a lot of ways. In one, it helps performance, is what the companies are starting to prove with statistics, but mostly it helps hold in the muscle, like Dr. Dentoni was talking about, and help with that reverberation. But mostly it's enhancing the return of the blood to the heart. So of course that would help with their circulation.
Right. Enhancing the blood to the heart is a very good thing for all of us to do.
Yes.
Whether we're pregnant, we're standing, we're sitting, or we're exercising.
And the graduated compression that they're doing is better than just a stiff pressure that would push on someone's arteries. You know, maybe somebody's going to do a marathon, and what if they're 70, you know, some age that they start to have some arterial problems? You want to make sure you have a graduated.
Okay. Well, Terri, I want to thank you for coming in and talking today about a subject. We are definitely kindred spirits. We both love and believe in compression.
Yes, we do.
Thank you so much.
Thanks a lot.